get everybody who's here now, right? Okay. I want to thank everyone for being here today, and I'm pleased to be joined by House and Senate healthcare leaders to highlight President Trump's broken promises on healthcare during the first 100 days of his presidency. And the broken promises are outlined in a Democratic report, which I believe was just released just prior to our press event here now. We all remember candidate Trump promising last year to repeal the Affordable Care Act and replace it with, and I quote, insurance for everybody. He promised something far less expensive and far better. But instead, President Trump supported a devastating bill that would have taken away health care from 24 million Americans, and millions of others would have had to be forced to pay more for less, essentially out of pocket. As a candidate, President Trump promised everybody will be taken care of much better. But again, that's another broken promise. The Republican Trump Care bill would have forced older Americans to pay an age tax. Insurance companies could charge them 5 times as much as younger people. And Trump Care would also allow insurance companies to refuse to cover essential health benefits like maternity care, prescription drugs, and hospitalization. So much for being better off. Clearly not. And remember candidate Trump's promise that there will be no cuts to Social Security, Medicare, and Medicaid. Well, again, broken promises. Trump Care is Robin Hood in reverse. It takes $1 trillion from Medicare and Medicaid, all in order to give $900 million in tax cuts to the wealthy and to corporations. Now, those are a lot of promises, and when congressional Republicans concluded they couldn't meet these promises, they drafted the bill in secret and tried to ram it through the House without a single legislative hearing. Fortunately, the American people were not fooled, and they made their voices heard. While we're all relieved that we successfully defeated Trump Care last month, President Trump and congressional Republicans are not giving up. He continues, as the president, continues to purposely sabotage the ACA's marketplaces, creating needless uncertainty. And as you know, House Republicans continue to talk in secret about ways to get the votes to pass Trump Care in the House. Based on the press reports, their proposals would already make a bad bill even worse. So it's time for President Trump to stop misleading the American people, to stop threatening America's health care, and to join us in working to improve the law. And I'd like now to introduce Senator Patty Murray, the ranking member of the Senate Health Committee, who is a longtime health care champion.
Thank you. Well, good afternoon, and thank you to Representative Pallone, who's doing a great job standing up for our family's health care, for all of my friends from both sides of the Capitol who are here today. Thank you all for being here. You know, when it comes to health care, it seems to me like President Trump has made just about every promise he could dream up. He said he would provide insurance for everybody. He said he would make health care cheaper, and that he would make it work better for families. And he said he would get that all done right away on day one. Well, we are nearly 100 days in, and people across the country, as those who voted for President Trump and those who did not, expect him to deliver. But he is coming up as short as it gets. His disastrous Trump Care legislation breaks every single one of those promises. He would kick tens of millions of people off of coverage, cause premiums to spike, target seniors for higher costs, defund Planned Parenthood, and undermine key protections that women and families rely on to make sure insurance companies actually provide coverage that meet their needs. Now, people across the country spoke loud and clear against the Trump Care bill and made sure it couldn't even come to the House floor. But because one disastrous bill full of broken promises isn't enough, President Trump is not only trying to bring this back up, he and Republicans are actually finding ways to make this terrible bill even worse. House Republicans introduced a plan late last night that would double down on undermining protections for people with pre-existing conditions, forcing millions of them in states across the country to pay dramatically more for their care, and allow states to implement an even worse age tax on seniors. To be clear, access to health care coverage doesn't mean anything if it isn't affordable and high quality too. President Trump has also threatened to create Trump Care by sabotaging the health care system if he doesn't get his way, which would increase premiums for families nationwide. Families should not have to pay the price for President Trump's broken promises and his political gamesmanship. And Democrats are going to keep fighting as hard as we can to make sure that does not happen. I also want to note that while President Trump couldn't have shattered his health care promises into smaller pieces, he is doing everything he can to keep his promise to extreme conservative politicians when it comes to playing football with women's health care specific, political football. His Trump Care bill would spell disaster for women. He nominated an extreme anti-choice justice to the Supreme Court in Neil Gorsuch, even though it required Vice President Pence to cast tie-breaking votes not once, but twice. He signed legislation that allows discrimination against family planning centers simply based on the kinds of services they provide. I could go on, and I know he's not done yet, but this is the good news. Neither are women and families across our country. As painful as the last 100 days have been, people are continuing to make calls, to rally, and stand up for what is right. Democrats are going to keep standing up with them every step of the way, and we will continue to do everything we can to hold President Trump and his administration accountable. Is Bobby Scott here? We'll let Bobby Scott go in a minute, but I am very proud to introduce my colleague in the Senate, who's the ranking member on the Finance Committee, who's been hand in hand working with me all the way along to make sure that Trump Care doesn't sabotage the millions of families who rely on health care in this country.
Thank you, Senator Murray, and particularly to our friends, Congressman Pallone, my partner on taxes, Rich Neal. And look, I'm just going to make a few comments. First, if you don't get it right at the beginning, and they surely had a debacle on health care on the first effort, you say, we're going to get it right on the next round. But what we have seen with respect to the second efforts is once again, they've gotten it wrong, and they've gotten it wrong on the big issues. They're wrong on affordability. They're wrong on pre-existing conditions. They're wrong on premiums. And I want to take special note on it because I wrote the provision in the Affordable Care Act that provides for state waivers. And apparently this will be a big focus of their work going forward. It's Section 1332, if you're interested in some eye-glazing reading tonight. But the heart of the state waiver provision, and Senator Murray and I worked very closely on this, is that states are given the right to do better. In other words, if states have better ideas to hold down costs and expand coverage, the state would have the right to do that. The state does not have the right, under the law, to do worse. And everything that we're hearing is that the Republican version with respect to state waivers is it is really a right to do worse. It is a right to do worse by patients, a right to make care less affordable. Two other points real quickly, and then I get to introduce my friend Rich Neal. Congressman Neal and I are in charge of the tax side. Senator Murray and I always joke is that she's got to figure out how to create a program. Congressman Neal and I got to figure out how to pay for it. And Frank has a little bit of both. He and Senator Murray particularly are partners on some of these kinds of issues from jurisdiction. What Congressman Neal and I pointed out, and it certainly could be made worse again by the announcement on taxes here at 1:30, is the initial efforts would, for example, cut the Medicare tax, which you see on every single premium in America for only one group of people. And those are couples making over $250,000 a year. The group that least needs a Medicare tax cut is the one group that gets one. So that's what Congressman Neal and I have been trying to point out. I just want to make one last point on the issue that Senator Murray touched on, and that's this question of cost sharing, which has been so important for 7 to 8 million people. These are the people who need some help with their deductibles and co-payments. The fact is, this president has prided himself on knowing the art of the deal. And this president has been making these payments this year. If he chooses to stop making the payments, it blows up the market. And that would be a very bad deal for the president, who particularly touts his ideas for making a deal. So I'm really glad to have Congressman Neal. I see Congressman Scott as well, and we're all trying to get through the order quickly.
Thanks very much, Ron. And I thought it was very nice that Ron Wyden described institutionally the difference between being on Ways and Means and Finance or being an appropriator, because they do the spending and we have to figure out how to pay for it, and further complicating the issues in front of us. Much of what we do with Financial Ways and Means is pretty arcane. Everybody would agree with that. The president acknowledged that healthcare is very complex, more complex than he'd anticipated, even though Harry Truman took a different position on that 70 years ago, pointing out how complicated it was. But everybody could understand this. The president has proposed taking $800 billion out of Medicaid to justify a $1 trillion tax cut for the top 1% of income earners in America. Now, what does that mean? It means now that, again, it's been underreported, but more people in America today receive Medicaid benefits than receive Medicare benefits. And where has that growth come from? Largely, that growth has come from nursing home care. And as we celebrate increases in terms of life expectancy, there are corresponding issues that accompany it, including the fact that as people live longer in America, there's going to be more dementia, there's going to be more Alzheimer's disease, and quickly, Medicaid has become our long-term care initiative. So what the president essentially proposed by cutting that money from Medicaid was not just to harm the Affordable Care Act, but a very important part of it is what's happened to long-term care over many years. So 22 million Americans today have health insurance that didn't. Part of that is the growth in Medicaid. But much of this was done to collapse support for the ACA based upon the idea that the people at the very top would be rewarded once again. And just to call attention quickly to the media that is here. That Pew Research Center study that has been concluded is not a Democratic study. It is not a Republican study. It's not a libertarian. It's not a socialist study. It is an academic undertaking that highlights what has happened to the greatest period of concentrated wealth in American history. And much of it, I must say, from unearned income, because we have tilted that so far toward people at the very top. The idea of the ACA was simply to provide people who were outside the mainstream of American economic life with an opportunity to become insured. And remember, even as 11 million more people have received the Medicaid benefit through subsidy, there's another very important part of this argument, and that is 11 more million people have entered the private insurance market. That's what we all wanted. That was the desirable goal. So as we go forward on this, it's pretty obvious that where their plan is, it's for a big tax cut at the expense of the 22 million people who now have health insurance. My seatmate on the Hartford shuttle, frequently a member of, an alum of the House, and a really capable individual, is Senator Murphy from Connecticut.
You can go then, Bobby.
Well, listen, thank you very much, Representative Neal. Glad to join all of my colleagues. Candidate Trump made a host of wild, big promises during the campaign. I think what's most offensive to people of this country is that it's pretty apparent that he's not even trying to fulfill the promises that he made, right? Let's be honest. Donald Trump didn't know anything about the American healthcare system when he became president. He largely outsourced the authorship of this bill to a cabal of House Republicans who wrote it in private and then gladly offered himself as a cheerleader and champion of it once it was released. But what people are starting to figure out is that he never had any intention to fulfill all of the promises he made. And chief amongst them are the set of ridiculous promises he made on healthcare. He told people that their healthcare was going to be better, that it was going to be cheaper, and that it was going to all be done through the repeal of Obamacare. He never had an inkling of a plan to get that done. And when push came to shove, he only spent 17 days trying to pass a rewrite of 1/6 of the American economy because it became the most unpopular bill in the shortest period of time that Congress has ever seen. The day before it got pulled in the House of Representatives, Quinnipiac University polling had it pegged at 17% approval. And so I think what makes it difficult for a lot of his supporters is that it's pretty clear he had no intention of fulfilling this promise to make the healthcare system better, no plan to do it. And as Senator Murray said, he is trying to undermine the healthcare system every single day, whether it's pulling the advertising, casting doubt over whether he is going to continue to pay these subsidies to help push down the cost sharing for individuals. President Trump is trying to sabotage the American healthcare system, but people get that too. They saw how unserious he was about trying to reform the system, and they see how vindictive he is against Democrats and people who opposed his plan now as he tries to sabotage this system. People get it, right? People's eyes are waking up, are opening up all across the country. Donald Trump made a lot of promises. He made a lot of promises on healthcare, and he had no intention of fulfilling them. And the next question people are going to ask is, what is the real motivation of this administration? Right? If they're not really about fulfilling their campaign promises, then what are they doing in the White House? And is this just a scheme to enrich himself and his friends, not to do better by the American people? That's the next question that a lot of Americans are going to be asking. With that, let me introduce a great champion for healthcare in the House, a great fighter against the American Health Care Act, Representative Bustos.
Thank you, Senator. When you look at areas that Donald Trump made a lot of promises to, and that showed up overwhelmingly in support of him, that would be rural America. And that's the kind of congressional district that I represent. My name is Sherry Bustos. My congressional district is 7,000 square miles, 14 counties. 11 of those counties are rural. The other 3 are rural-ish. And they supported Donald Trump because he talked about jobs and the economy, and that resonated with them. And in the counties I represent, there are 16 rural hospitals and clinics. And in many of these communities, they are the largest employer, and they are among the jobs that pay the best. So they are very important. So from that perspective, we're talking about 60,000 jobs in the state of Illinois that are at risk under this Trump Care bill. Nationally, that's almost 2 million jobs. So literally, when I look at rural America and when I look at my congressional district, Donald Trump is looking at ripping out the beating heart of rural America, and probably the gizzard too. I mean, this is very important from a jobs perspective, from people who want to just go and have a baby at a hospital that now they'll have to drive farther to go to, people who are having a heart attack who will have to go even farther. So this is literally putting people's lives at risk. So in the Midwest, where I've lived my entire life, we have a firm belief that in looking people in the eye and telling the truth. And what we've seen in these almost 100 days is that what Donald Trump says and what Donald Trump does end up being 2 different things. I said on the day that Donald Trump was elected, I said it on the day he was inaugurated, that I'm willing to work with him if he wants to make sure that he's taking care of the people I represent, hardworking men and women. But if he doesn't do that, he's going to have a fight on his hands. And right now, he's got a fight on his hands. To add further perspective to this, I'd like to introduce my colleague, Congressman Bobby Scott, and then after that, we will open it up for questions.
Thank you, thank you, Sherry. You know, I think in addition to what's already been said, I think we need to make sure that we review what the situation was when the Affordable Care Act passed. We know that costs were going through the roof. Those with pre-existing conditions could not get insurance, or if they did, it was at an exorbitant price. Women were paying more than men, and every year, millions of people were losing their insurance. We also had a situation where we were, everybody with insurance was paying for those uninsured through uncompensated care cost shifting. That cost the average family about $1,000 a year. We passed the Affordable Care Act. Now, the rates have still gone up, but at the lowest rate in 50 years. Those with pre-existing conditions can get insurance at the standard rate. Women aren't paying more than men, and instead of millions of people losing their insurance every year, 20 million more people have insurance. We've also improved consumer protections. The full name of the Affordable Care Act is the Patient Protection and Affordable Care Act, and we have patient protections. Your coverage can't be canceled by the insurance company. You have preventive services with no copays and deductibles. Those up to 26 can stay in their parents' policies. We're closing the donut hole. We've put money into community health centers and invested in education for doctors and other health professionals so that we'll have more professionals meeting the need. That's where we are today. Now, President Trump has promised that he can provide more people coverage, everybody covered, at a lower cost and even better benefits. And then you look at the plan they presented. 24 million fewer people insured, the costs go up, and the quality of the insurance goes down. In addition to that, 22 million people will lose their jobs, and while all that pain is being inflicted, millionaires get tax cuts. We can do better than that. We've said if you want to improve the law, we're willing to work to improve the law, but we're not going to help them go backwards.
And we'll open up for questions at this point. Sir?
Jonathan Salanto with the Star Ledger, and Congressman Pallone, you answer this for obvious reasons. The proposals now, after it was defeated, a lot of moderates, that's your state, also voted now. Proposals now would reduce pre-existing conditions, would reduce the essential care packages, give states all those waivers. Why do you think they're moving in that direction rather than to strengthen it, to try to get you on board and the Democrats on board to support an amended version?
Well, Jonathan, you know, this latest proposal, I'll call it the MacArthur proposal because he's gotten the most attention in our state, was clearly designed to reach out to the right, the Freedom Caucus, the Tea Party, whatever they call themselves these days. And that's what it is. It's making the situation even worse because essentially a state can get a waiver almost automatically from the essential benefits package, from any age rating. You can basically, the original bill I think said you could go up to 5 times younger people for people that are 50 or 65. Now it's unlimited if you get the waiver. And then it also gets rid of the community ratings. So essentially, you can charge people more because they're sicker or they have more health problems. So it's just, I mean, the Freedom Caucus is against all the Title I anti-discrimination, patient protections, essential benefit package, all the things that we, put in the ACA because we thought they were so important. And this essentially goes back to the Wild West of the old days when, North Carolina was offering for $50 a month, you could buy health insurance that didn't include hospitalization. And that's where we're going to reach out to this Freedom Caucus. Now, whether or not that brings enough of them and you don't lose more moderates, I have no idea. I would think if I was a moderate, like a lot of the New Jersey Republicans who said they were going to vote no, most of them, 4 out of 5, other than MacArthur, that they would be horrified and say, there's no way I'm changing my vote. But, I'm not here to see what the Republicans are doing. They're in the majority. If they think they're going to take another run out of it, it's obviously going to be a worse bill and more breaking the promise of what President Trump said.
Ma'am?
Julie Rogner from Kaiser Health News. Speaker Ryan said this morning that the cost sharing reduction appropriation will not be in the CR, and that it's not the appropriate place for it. But isn't that exactly what the fight is about? That Congress didn't appropriate the money, so if Congress were to, isn't that where it would go?
Julie, look, as far as I can tell, this is another example of one hand not talking to the other. CMS, Ms. Verma, as far as I can tell, says it's up to the Congress. The Speaker says it's up to the administration. Senator Murray and I have been working very closely, together on this. And the reality is, this is a manufactured crisis. This administration, President Trump, has the authority to make the payments. He has been making them. Or, if he chooses to, he could actually put it in the CR. And Senator Murray knows a lot about that, but everything we understand is that would cost nothing, because then it would go into the budget, baseline.
It's already there.
Right. So, I want to turn this over, to Senator Murray, but I want to come back to the point I made, because this is a review of the president's promises. The president has prided himself on knowing the art of the deal. He has been making these payments. If the president chooses to stop, it blows up the market. And Senator Murray and I have been talking about the fact this is really the key window right now. The plans are getting ready to make decisions and the like. And so people ought to understand that this is another example of the fellow who says that he's the great, deal maker, letting the public down. And if he chooses to stop, it blows up the market. And Senator Murray and I have been working on this.
I would just add this. Look, it's really ironic to me that the Republicans and President Trump are saying don't put anything into the CR on this. That would save them everything, because this is their problem. If the president decides to not continue these payments, it will create a Trump care disaster for him, where millions of people's payments will go up, insurance companies will drop their coverage, and Americans will lose. So I don't know why Trump and the Republicans are saying don't do anything here, because if they say don't do anything, they own the problem.
Can you speak a little bit more about the MacArthur Amendment? The Republicans are arguing that all this does is give states more flexibility, and that they say premiums can't go up because of the sort of triggers that they've set in this amendment. Can you respond to that?
Bobby talked about the good old days, or I'll call them the bad old days. That's what they're doing, right? In other words, in the good or bad old days before the ACA, right, you could, charge somebody who was 50 to 65 before they get to Medicare, pretty much whatever you wanted, depending on what the state, if the state had any laws. Some states were different, but many you could do whatever you want. You want to deny people insurance because of a pre-existing condition, you could do that. I think what they're saying now is, well, those people, if they're denied, they can go into a high-risk pool. But we know that doesn't work, because there's never enough money in the high-risk pool. And traditionally, before the ACA, a lot of states that had high-risk pools, they had all kinds of caps and restrictions on your eligibility for that based on your pre-existing conditions, right? And as far as essential benefits package, I always tell the case about when I went to Rules when we were doing the ACA, and Virginia Fox, not that I like to pick her out, but she doesn't mind anyway. And she said, well, in North Carolina, we offer, you can buy insurance for $50 a month. And I said, well, what does it include? And then I realized it didn't include hospitalization. Well, CBO doesn't even score that as an insurance policy. If you ask me and you're selling an insurance policy that doesn't include hospitalization, I don't have health insurance with that. So this is what they're going to allow again. Now, sure, some states may say we're not going that route, but that's not the point. The point is we don't want to go back to the situation where all these discriminatory practices and junk insurance were being sold in a lot of jurisdictions. And that's what the Freedom Caucus wants. They want to go back to those days when you had junk insurance, You had, you could charge it whatever you want. You could exclude people for pre-existing. That's what the MacArthur Amendment's all about.
Yeah, I think we're willing to work to improve the Affordable Care Act. As I understand this amendment, it keeps all the bad parts of the program, takes all the bad parts out that created 24 million uninsured, increased the price, and lowered the quality, but made all those bad things optional and let the state do it. There are no improvements in the bill, only optional ways to make it worse. And so I don't see how that can count as improving the Affordable Care Act when all of the options take us in the wrong direction.
And it runs contrary. The point that Congressman Scott has just made, it runs contrary to what the Republicans said they wanted in terms of state flexibility and state options to do better. We put 1332 in the Affordable Care Act for the express reason that Congressman Scott just said. If states, as they told us, had the ability to be more creative and to come up with fresh approaches that would actually cover people, do more to hold costs and the like, they were free to do it. But it explicitly said they did not have a legal right to do worse. So what the Republicans in the House are now saying, under the guise of flexibility and waivers and the like, is they really don't believe what they said during the whole debate about the Affordable Care Act. During the Affordable Care Act, they constantly said, we can do a better job. Just give us a right to do it. Don't say in Washington, D.C. that what happens in Virginia is what's going to happen in Oregon and Washington. Now they're showing they really don't believe the claims that they made during the debate about the Affordable Care Act. They are asking for a legal right to do worse, as Congressman Scott just pointed out.
Yes, sir.
More than 100 of your colleagues in the House have signed on to the single-payer bill, H.R. 676. And Senator Sanders says he's going to introduce a companion bill in a couple of weeks. You've all talked about improving the ACA. Do you see single-payer as an improvement? And do any of you support it? And if not, why not?
Well, and listen, anything's an improvement from the dumpster fire of a bill that the Republicans are pushing through the House of Representatives. The fact of the matter is that the country's hair is on fire right now because there are 24 million people that are potentially going to lose insurance and hundreds millions more who are going to have their rates jacked up. So all of our focus is on stopping this horrible proposal from becoming law. And we have been very open about wanting to work with Republicans to keep what works in the Affordable Care Act and make improvements where they're necessary. I understand there's another conversation happening about, an ultimate replacement for the existing healthcare system, but, we're focused on stopping this piece of legislation because it is a real, current, present threat to our constituents. Speaking for myself, I'm a supporter of the public option. I think that giving consumers the choice to join a Medicare system or stay in private insurance is the best way to go. So my preference is to do it through a public option and let people choose. But I think our energy now has to be focused on stopping this piece of legislation from becoming law and holding this administration to the promises that they made to protect Americans from healthcare harm.
Any state that wants to set up their own public option using 1332 has the legal authority to do it.
Are you opposed to single payer?
I've said, look, I want states, and by the way, a number of states are looking at trying to do single payer as well through 1332. What I want to do, as we've talked about, is get on right now with as much business as we can, particularly because this is what a lot of the motivation is, to hold down prescription drug costs and hold down insurance bills. And in places, for example, where there's only one insurance choice, and there are some of those, a state could set up a public option and they could move right away to do it.
We have one final question from anyone? All right, thanks, everyone.
Thank you.
Very good. to